Nuclear medicine. Nuclear medicine is a young and rapidly evolving field that blends science, technology, and human anatomy. Unlike general radiologic technology, which uses external radiation like X-rays to view structures like bones, nuclear medicine uses internal radiation using tracers that travel inside the body to show us how organs and tissues are functioning. At the bottom of the screen, there are three images showing parts of the nuclear medicine imaging process. In image 1 on the left, you see a nuclear medicine technologist preparing the imaging equipment for a scan. Before the scan, the patient is given a radiopharmaceutical. There is then a waiting period to allow the tracer to localize in the body. In the middle image, it's showing that a radiopharmaceutical has been injected into the patient's vein. You can also see the scintillation camera above the patient. That detects the radiation emitted from inside the body and transmits that data to an image display system. On the right, you see the final diagnostic image. This shows radiotracer concentration and abnormal function in specific areas of the body, highlighting regions of metabolic activity often used to detect cancer, infection, or organ function. Nuclear medicine uses radioactive tracers or radiopharmaceuticals, which are specially designed compounds attached to radioactive isotopes. Tracers are selected based on the condition being studied. The tracers can target specific proteins, sugars, or cells. A few commonly used tracers include technetium-99, gallium-67, fluorodeoxyglucose, or FDG. An example of when nuclear medicine imaging would be used would be, say a patient is suspected of having intestinal bleeding. A sample of their own red blood cells could be radio-labeled, re-injected, and then traced using a scan. The areas of high radioactivity point directly to the bleeding site. The two most common imaging types in nuclear medicine are SPECT and PET scans. SPECT, or single photon emission computed tomography, uses gamma rays and rotating cameras to create 3D images of the tracer inside the body. PET, or positron emission tomography, detects positrons, which are particles similar to electrons but with opposite charge. PET scans are powerful tools for detecting cancer, monitoring its spread, and tracking how well treatment works. The tracers are usually given by IV injection but can be inhaled, swallowed, or directly injected, depending on what needs to be examined. Regarding radiation dose, the level is similar to that of a chest X-ray or CT scan. Nuclear medicine is driven by constant discovery. Advances in molecular biology, radiopharmaceutical development, and imaging technology are transforming how we detect and treat disease. One of the biggest challenges in this field is keeping up with its rapid evolution, but that's also what makes it so exciting. In short, while radiology shows us what the body looks like, nuclear medicine shows us how the body works, making it a powerful tool for early detection, accurate diagnosis, and personalized treatment.